you. Kia ora koutou. Ko Cristina Cleghorn toku ingoa. I'm the PI of the Sustainable New Zealand Kai project, and it's my privilege to talk to you today about this project. So this is our team. We've got Nung Naim and Cleona on the left there, Bruce Kidd, who is a research fellow on the project, Hemi Enright, who will be speaking to you next on his master's dissertation, Cleona again, sorry, Cristina Mako, who was instrumental in carrying out this project, and Andrew Reynolds, who also did a master's project on this project, and me. So I just wanted to start by giving you a bit of context to the project. This work sits in the health and climate co-benefits space. So we're looking for ways of changing diet and dietary policies that can support people to eat more healthy and sustainable foods. There's a couple of examples on this slide, but just to look at the consuming less meat circle, this impacts on climate change through reducing livestock production, reducing deforestation, and both these things reduce greenhouse gas emissions through both carbon dioxide and methane emissions. So this reduction in climate change has its own health benefits, but reducing meat intake also has those direct health benefits, reducing cardiovascular disease and lower rates of cancer. So this 3.5-year project had 6 different objectives, so a lot of work and sub-projects under each objective. So unfortunately I can't speak to you about all of this. So I'm just going to focus in on the kind of 2 aspects that I hope is of most interest to this audience. So firstly, the extensive consultation that we did as part of this, and secondly, the modelling work. So I'm just going to start by talking about the consultation. This was broken down into 3 stages. In the first stage, we did 6 focus groups with Ministry of Health, Ministry for Primary Industries, Ministry for the Environment, a local community group, a marae and Petone, and a focus group that we recruited through the steering group of the Healthy Families East Cape Kitchen Table Talks in Tairāwhiti. And this was to try and get some perspectives from Māori living more rurally. The focus of this first stage was to discuss what sustainable diets meant to these stakeholders and to get a range of policy suggestions of what could be implemented in New Zealand. We came up through this process with 111 unique policies, and then 14 of these policies went on to stage 2. So those were the policies that had evidence of effectiveness in terms of changing people's diets. Then the same stakeholders and our advisory group rated these policies on 5 different criteria, and the top 6 rated policies went through to the final stage of consultation, where we took them back to the same focus groups and interviews. Sorry, I forgot to mention we did 13 interviews as well in that stage 1 process. In stage 3, we talked in detail about each of the policies to try and figure out how stakeholders thought they should be implemented in New Zealand. The data from stage 3 was used in developing the policies that we modelled further on in the project, which I'll talk about shortly. But first, I'm hoping you can read some of those quotes. These are just a sample of the policies that were suggested, those 111 policies, and a few quotes of what people thought about them. So we divided the policies, we categorised them using the nourishing framework that Cleona helpfully introduced for me. 34% of the policies fell within the food environments domain, such as incorporating environmental sustainability into dietary guidelines. 17% fell within the behaviour change communication at the bottom there, and that's policies such as funding community cooking workshops. And then 49% fell within the food systems domain. And there were really broad policies suggested here, and they had a wide range of ideas, from establishing a ministry for food, reviewing pesticide laws, and supporting marakai. So these are the top-rated policies that came out of this process. We've got making healthy food and drink policies mandatory in all schools in Kura, supporting marakai and community gardens through providing resources and staffing, scaling up and resourcing the established garden-to-table programs in schools in Kura, educating the public about sustainable and healthy food through a mass media campaign, increasing incomes so people have the flexibility to choose healthy and sustainable foods, and removing GST from sustainable core foods. So now I'm going to talk about the modelling. I'm unsure how to make this play. Click again.
The idea of this health modelling. Imagine a large, finely tuned machine. Data goes in one end. Results come out at the other end. We can change variables on the machine to test different scenarios and ask ourselves, what if? For dietary modelling, the model is used to predict the impact of dietary policies or theoretical changes in food intake. Anonymous data on the population of New Zealand goes in one end. Then dietary consumption is adjusted to reflect the policy being modelled. Then the modelling results show expected changes in numbers of people with different diseases, the death rates and quality of life of those people, changes to health equity, the environment, and healthcare costs. The team uses existing evidence of effectiveness to form different policies, for example, removing GST on fruit and vegetables perhaps. The evidence is used to input any anticipated changes the policy would have on New Zealand's diet. For example, people eating more vegetables and less meat. Then the model will show them the changes and results. Less projected deaths, better quality of life, and healthier environment, for example. In addition, the model can also predict the financial costs or benefits of dietary policies. The cost of implementing a policy is calculated here. For example, the cost of changing the law, which can be compared with any changes in health system costs. Often, introducing a new policy might cost money, but would end up saving more money in health spending as a result. This is how evidence and actual data on all the people living in Aotearoa can be used to inform decisions about how we can improve our health, our environment, our spending. In short, how we can improve our lives.
Okay, so moving on to talk about some of the results of this project. As the video explained, we use this to look at the impact of both theoretical changes in dietary intake and policies that support people to consume more healthy and sustainable foods. So this is an example of one of the theoretical scenarios. We did quite a few of them, but I just wanted to present this one to you. It's the whole of the New Zealand population switching over to consume the Eat Lancet Commission's Healthy Sustainable Diet that was published in 2019. So I've matched this diet to our baseline diet, the National Nutrition Survey, and we can compare the baseline diet in the brown bars there with the Eat Lancet diet in the blue bars. So as you can see, under the Eat Lancet diet, there's a lot more vegetables and nuts and seeds. There's more fruit and whole grains, as represented by the bread and breakfast cereal bars, and also the grains are exclusively whole grain under the Eat Lancet diet. There's less poultry, potatoes, kumara and taro, and lots less sweet treats, red and processed meat, pasta and bread-based dishes. So we modelled the shift for the whole of the New Zealand population onto this diet, and we found really large health gains. So for every 1,000 people in the population, they gained 312 healthy life years over their life course. The reduction in disease incidence also saved really large amount of money for the health system, so 20.5 billion was saved over the life course of the population. Per capita health gain was higher for Māori compared to non-Māori, so 1.7 higher, or 70% higher for Māori. And the climate impact for the Eat Lancet diet was 57% of the baseline, so has the potential to reduce our nation's impact on the climate. So unfortunately we haven't got our policies illustrated yet, so we're just going to have to make do with a table. So we've modelled 5 policies, 3 in adults and 2 in children. I'm just presenting the results for adults here. So the policy that had the largest health gain was removing GST from sustainable core foods, and that gave a health gain of 23 healthy adjusted life years over the life course, and it saved $1 billion in health system costs over the same time period. The health gains were 40% higher for Māori. The next policy, educating the public about sustainable and healthy foods, this was also cost saving, so it would save $37 million. The health gains were small, but again, 60% higher health gains for Māori. Supporting marakai and community gardens was an expensive policy, as the stakeholders were really keen for there to be an employed person per garden to keep the gardens going. So if we employed someone at half-time, we found that this policy was cost-effective but not cost-saving. So it would cost about $44,000 per each health-adjusted life year to run this policy, and would cost $360 million to the government. Again, small health gains, but 50% higher health gains for Māori. So this last policy is a good example of the scope of the cost effectiveness analyses that we are doing for this project. We look at the change in diet and how that impacts chronic disease, which is important, but it doesn't capture all of the benefits of these policies. And those wider benefits to individuals, whānau and society need to be considered as well. So the findings provide evidence for policymakers on policies that encourage consumption of healthy, sustainable foods and how these will impact our population health, health system costs and health equity. At this stage, there are obvious political barriers to implementation, but there is also widespread public support for change. So, for example, in this project, the policies that we modelled were considered by the stakeholders to be positive in terms of changes for Māori health, New Zealand diets, environmental impact. They felt that they would be relatively easy to implement and would have good acceptability. So we need to grow this public support while continuing to provide clear evidence of impact. So we've demonstrated that population level changes to dietary intake can generate large health gains, health system cost savings, improvements to health equity and positive climate impact. Feasible policies have been identified and designed by a range of stakeholders that could be implemented to improve the health of New Zealanders, and the policies that we modelled in adults were either cost saving or cost effective. When we're considering these policies, it's important to consider the wider benefits of the policies to food security, social cohesion, well-being, the local economy, the environment, and food system resilience. So I just wanted to say a big thank you to the stakeholders that took part in this project, and also the Sustainable New Zealand Kai team. It's been a pleasure working with you all on this project. Thanks to Toby Morris and Daylight for illustrating the project so far, and also Healthier Lives for funding this work. Just going to hand over to Hemi, and he's going to talk about the work that he did on this project for his master's dissertation.
Tēnā koutou katoa, ko Ngāpui, ko Ngā Tironui, rautou ko Ngā Ruahine toku iwi, ko Hemi toku ingoa. Kia ora koutou, I'm just going to lift this up a little bit. So I'm Hemi, I'm doing some training in public health and also working a bit in general practice out in Porirua, heading into work after this, so see how we go. My dissertation focused on exploring Māori views and connecting with Māori stakeholders and contributors in this project. And yeah, I just wanted to start by acknowledging the wider team and the support of my supervisors, particularly Cristina Cleghorn, who comes from a dietetics background and who has whakapapa to the Gisborne Tairāwhiti region, and had all the connections and relationships already developed, and I just sort of slotted in there, went to the focus groups and became a part of that existing network of connections. So I just wanted to acknowledge Cristina. So in terms of the dissertation itself, this is kind of more of a lifelong kaupapa. It doesn't really fit into a narrow box or a kind of dissertation box. I'm glad that I got to explore this kaupapa and connect with these people across the country, but it's an ongoing sort of commitment that we're all a part of, and we've got an ongoing narrative or pūrākau that began, with our atua, with haumie, with rongo, in terms of our haumie and the ngahere and mahinga kai food sources, wild and foraged sources of food, and rongo in terms of the domain of marakai and cultivated foods. So this is kind of just sort of scratching the surface, and just wanted to acknowledge the wider kaupapa and how this is kind of a, massive movement that's been going on for centuries and will continue to go on after this. So just in terms of framing the project, so a lot of the work in the climate, health and global warming space kind of creates a sense of humanity as a sort of homogenous group, but just wanted to acknowledge within that there's a lot of variability and there's a lot of power imbalances and different histories of different groups. So for us as Māori, as tangata whenua, there's the context of colonisation as an ongoing process that's severely impacted our ability to uphold te ao Māori rangatiratanga and enact key critical values such as the practice of kaitiakitanga over natural resources and whenua. A lot of work has already gone into this space, and I just wanted to acknowledge Jessica Hutchings, who's published extensively on this area and who I've relied on for definitions such as my definition of kai rangatiratanga, which is about the intentional act and expression of sovereignty over kai produced, consumed and returned to papa tuanuku. So again, reframing and acknowledging atua within that context. Also just wanted to acknowledge the work of Moana Jackson and Margaret Mutu with Mātaki Mai, and their work and Flax Roots engagement across the motu to talk about policy and how to reframe things in the context of te tiriti. So in terms of a brief review of the project that I completed, so we did a literature review looking at, I think, 7 or 8 different databases, and identified some key themes and spun that into a collective narrative on kai, and I've pulled out some of those themes. In terms of the presentation of themes, we tried really hard to not have any power imbalances between themes, so we don't go into sub-themes. Everything's sort of presented as being on a level playing field. Of course, this was a kaupapa Māori methodology with qualitative research methods in terms of key stakeholder interviews and focus groups, and the people that we had the privilege of meeting with and that contributed to this work were tangata whenua doing the mahi for whānau, hapu, iwi, in government and in regional initiatives around the motu. So in terms of weaving together the strands, so after I transcribed the data and coded it through in vivo, and then did the thematic analysis, some key themes that came out were talking about atua in relation to kai, so hence why the reference back and, sort of walking backwards into the future, keeping our eyes fixed on the past in terms of referencing haumie and rongo. Then there was this, a lot of reference to colonisation, so differentiating from that, we talked a lot about decolonising our palates, thinking more about the tastes that our tipuna were exposed to, like the yuck, the bitter, from like fern roots or kawakawa in the ngahere, and also deconstructing our palates in terms of what we've been socially conditioned to consume, which is mainly sugar, fat, and other stuff and takeaways in our obesogenic food environment. A key narrative that came through is talking about kai that is Māori rich. We've got some quotes from participants following this, so I'll sort of just let those contributors speak for themselves. We also connected back to the whenua and the moana and talked about consuming our landscapes, which sort of keeps us within planetary bounds and keeps us in relation to our whenua, and how we are, it's sort of in flux, continuing to shift towards rangatiratanga, which is actualising leadership and ownership of the space and moving away from decolonisation, which is more than the things that we see around us, but also the way that we view things ourselves, and something that I've had to really go into of this project is sort of reframing and trying to recondition my thinking, which has been affected by my medical training and being brought up in this country. So I've got some quotes from some of the contributors, so I'll just sort of go through these and let them speak for themselves. And we had Gabrielle Baker do the illustrations, and she's done a wonderful job, and catching up with her this week to do some more themes and illustrations for the project for the next stage, which is dissemination. So kai was seen as being something broader than just the food in front of you or the portion sizes or eat more, eat less of this. It was something that actually, connected to your body, to your spirit, connected you to your whenua and your ancestors. So these are all direct quotes from the contributors. So flowing on from the analysis and recognising that we're just lightly touching on this, we came up with the recommendations at the end of the analysis chapter, and they were sort of centred around relationship building, and the key sort of idea being to listen to Māori for non-Māori policy actors working in the central government space, and also, looking at ourselves, understanding our positionality, understanding where we're coming from in that relationship to try and work towards something, working towards kai rangatiratanga, and acknowledging the responsibility that central government has in terms of having the collective resources and the collective mandate from the public to deliver on creating necessary conditions. And of course, listening to Māori and reframing and centering Māori views when designing initiatives in order to have the best impact on our communities. I just thought I'd end on that illustration as a very special kaitiaki species. Ngā mihi nui.